go to the most with some of our questions today, but we can go and get started, and then if the others join, that's great. Also, just note that this video is being recorded, so we'll post it on our website after the meeting for anybody else who'd like in the Georgia Mountains region who'd like to listen in and learn about what we're going to talk about today. So first off, good afternoon, and thank you, Brian, for attending. I really appreciate it. This is the 2050 Rural and Human Service Transportation Plans Regional Workshop, focusing on the Georgia Mountains region. My name is Matthew Wilson. I am the Mobility Manager for the Georgia Department of Transportation. I also serve as the Project Manager for this plan. And again, thank you for being here this afternoon. Just a few virtual housekeeping items. I'm going to keep it short since it's just a couple of us here. First, we ask everybody be on mute while the presentation is going on. That way, everyone can hear the presentation clearly. And then just the microphone on the very top right with a slash through it should be on. As we progress through the presentation, we have scheduled breaks for discussion and questions, and we do actively want your comments and questions. So please go ahead and type them in the chat box or unmute and let us know what your question may be. I don't think anybody's calling in, so I won't mention the call-in option. And real quick on the RHSS team itself. So the 2050 Rural and Human Services Transportation Plan is a 3-agency plan. I'll speak to that in the coming slides. The Georgia Departments of Transportation, Human Services, and Community Health are the plan sponsors. The plan is being developed with the help of a consultant team, including AECOM, Cambridge Systematics, and Modern Mobility Partners. Quickly over the agenda, we're going to run through the following topics. I will provide a brief introduction and some background on rural and human service transportation in Georgia. I will then hand it off to Will Brewer from AECOM to review the available transit and transportation services in the Georgia Mountains region. After that, Baird Bream from Cambridge Systematics will walk us through the region's transit needs. And then Kirsten Moat from Modern Mobility Partners will guide our discussion session. We will also have a couple question and discussion points throughout the workshop. So what exactly is rural and human service transportation? Not many people are familiar with the terms. Rural and Human Service Transportation, or RHST, are mobility services provided for the benefit of disadvantaged populations, including persons with disabilities, older adults, and persons without a vehicle. RHST includes services provided by public transit operators, human service agencies, private providers, and private nonprofit agencies. This 2050 RHST plan seeks to do a few things. First, we're going to do a general update of the existing conditions information from the previous plan. Then we're going to build upon the recommendations and efforts completed from that first plan to identify projects, programs, and policies to meet current and future, after 2050, demands and provide enhancements to the RHST across Georgia. I mentioned that this plan is a 3-agency plan. This is because the state of Georgia administers 3 systems to provide public transit, human service transportation, and non-emergency medical transportation, or NEMT, services. Each system is administered by different state agency using different funding sources. GDOT focuses on public transit for rural and small urban populations. DHS focuses on transportation services for seniors, low-income families, individuals with disabilities, and vocational training, while DCH focuses on transportation to medically necessary services for eligible Medicaid members. Coordination exists at the state, regional, and local levels. However, each agency's system operates independently using a variety of service delivery models with differing requirements. The state's role in governing transit is primarily to oversee compliance with federal grant requirements. There is no single state authority to set priorities for public transit and human service transportation, or to coordinate planning and funding of transit services for rural communities. A little bit on the history of the RHST plan. Back in 2007, the Georgia Departments of Human Services and Transportation completed the Coordinated Public Transit Human Services Transportation Plan. As an update of that plan, GDOT initiated the Georgia Rural and Human Services Transportation Plan 2.0 in 2011. The Plan 2.0 outlined coordination activities among the rural public and human service transportation providers across the state to achieve improved service delivery for the state's public transportation and human services transportation customers. The plan also developed recommendations to implement mobility management at the state and regional level. In 2021, GDOT, DHS, and DCH began developing an update, the 2050 Georgia RHST plan. The purpose of this plan is to provide a framework for additional coordination among Georgia's agencies impacted by mobility services and continue the work of the Technical Coordinating Group, which is now renamed the Technical Advisory Group, and expand its participation to additional stakeholders. A quick look at our plan schedule. You can see we've wrapped up our vision and goals, which I will discuss on the next slide, and are heavy into our existing conditions and needs assessment and beginning our alternatives analysis. What I want to focus on today is how to get people involved in this process and how we can get input from your region to help us understand needs and develop solutions. The stars on the schedule indicate stakeholder and public outreach efforts. Those with the pink circle indicate the Technical Advisory Group meetings. Outreach is a key component of the RHST plan update and ensures the agencies updating the plan fully understand the rural and human service transportation needs across the state. The Technical Advisory Group, which includes 3 state agencies sponsoring the plan, as well as representatives from regional commissions, the statewide Independent Living Council, and other stakeholders identified during the stakeholder engagement process. We are engaging stakeholders and the public in each of the 12 regions in Georgia through our regional workshops. We are also conducting a statewide survey for the RHST providers and a separate survey for riders, the link to which is on the QR code on the slide. These efforts will provide all Georgians an opportunity to access the status of the RHST plan and identify key needs and service coordination strategies. Additionally, public feedback will be elicited through the 30-day public comment review period for the draft RHST plan, which we are targeting for July. The vision and goals are structured from the statewide transit plan, which was published in December of 2020. Our vision statement outlines where we would like rural and human service transportation to be in 2050, which is to continue and grow statewide rural and human service transportation coordination to improve the quality of life and economic activities for all Georgians, specifically those in rural areas, those with disabilities, older adults, and persons without vehicles. Our 6 goals, again based on the statewide transit plan, outline how we seek to implement the vision. The first goal is to provide coordinated and efficient rural and human services transportation. The second is to provide a safe and sustainable RHST network. The third is to optimize public transit programs to best meet public transit systems and travelers' needs. The fourth is to ensure public transit coverage across the state to support mobility and access for all. The fifth is to connect rural transit to regional and urban centers. And finally, the sixth is to leverage technology and innovation to support public transit ridership and performance. I would now like to hand it over to Will Brewer from AECOM to walk us through the available transit in the Georgia Mountains region. Will?
Great. Thank you, Matt. Good afternoon, everyone. My name is Will Brewer. I'm with the AECOM team, transportation planner, and I'll be walking you through sort of a snapshot of what transit looks like in your region currently. And when we get to the discussion area, it'd be nice to kind of talk about if we are missing any data or anything. So we see right here, we have our 3 maps of the state. We'll be looking at public transit and those service areas as well. We will be looking at Department of Human Services and some of the divisions and agencies that are involved in that coordinated effort. And then finally, Department of Community Health and those service areas and regions. So here we are, this is your region. And so we really would like for you to take a very good look at this and see if this is exactly what is occurring in your region. So I'll start with Hall County. Hall Area Transit Services serves Gainesville and rural Hall County as well. It's demand response, 6 fixed routes, and paratransit. There are a number of rural demand response transit systems in the region, all seen in green here: Banks, Dawson, Habersham, Hart, Lumpkin, Rabun, and Towns County. And then those empty spots you see there, those 3 counties, Franklin, Stevens, and White, those are counties that do not have any transit. So that's something that we want to acknowledge and see where we can come up with new initiatives or strategies to improve that. With DHS, there are several divisions and agencies that are involved. Division of Aging assists older individuals, other at-risk adults, and their families. There's coverage there with that division. Division of Family and Children Services, which provides numerous support services and programs to help Georgia families and children in need. And then we have the Department of Behavioral Health and Developmental Disabilities, which provides services for mental health and substance abuse, intellectual and developmental disabilities, deaf and hard of hearing, and suicide prevention. Lastly, we have our non-emergency medical conducted by the Department of Community Health. And so there are two brokers that operate across the state in 5 different regions. And so for Georgia Mountains, there are 2 regions that actually coincide with this regional commission. So we have Southeast Trans broker that operates in the North region, and then we have Motive Care that operates in the East, and that would just be Hart County there. And now I believe we're going to get into a little bit of a discussion and see if we have any questions from the audience, and I'll hand it over to Kirsten.
Thanks. Yeah, so for our listener, we do have an interactive poll through menti.com. So on your computer or your smartphone, and I would encourage everybody that's on this call to go ahead and do that. You can log in. So you go to menti.com, MENTI. I'm going to do it here as well. And you're going to enter this code. So it's 5662542, or you can use the QR code. Let's see. D. And then once you do that, you will be able to 56625. So the first question. So in the Georgia Mountain region, what transportation services might we be missing? So I'll go back to the map that Will did an overview of, but maybe there are other transportation services that you're aware of that we're not indicating on here, or perhaps we're illustrating something incorrectly. As you can see for the DHS services, we're showing that aging transportation services are only available in Dawson and Hall counties and not in any of the others. So we want to make sure that we are reflecting accurate information, but also make sure that we're including all of the information. So if there are other transportation services, maybe there's a church that's providing transportation services to a certain group of people, or there's another nonprofit that's operating under a private funding source that doesn't fall under one of these 3 categories. Those are the types of transportation services that we want to be aware of. So I'll leave this up here for a minute. Let you kind of think about it. And then also, if anybody has any questions, feel free to unmute your microphone and ask those questions. So I'm not hearing any. So we can move on to the second question. Second question is, what are some constraints on existing systems? So are there funding constraints that aren't allowing systems to provide service during certain days of the week or certain times of the day that they should be? Are there constraints as far as labor pool, retaining employees, perhaps drivers, maintenance workers, mechanics? What other constraints are there on the system? Are there constraints as far as where a certain transit provider can provide access? Like I think on the non-emergency medical transportation, you saw that Hart County is the only county in the Georgia Mountain region that is operated by Motive Care as opposed to Southeast Trans. So does that cause any concerns or issues? So I'll give it a minute, see if anybody has anything to add here. Again, you can add your responses to menti.com, or if you would like to unmute and talk about those constraints, you may do that as well. Okay, so we're going to move on to the next section of the presentation, which is the needs assessment. So as Matt mentioned, we are undergoing the needs assessment right now. And Cambridge Systematics is taking the lead on that needs assessment. So we have Baird here today to present some of the findings from the Georgia Mountain region.
Good afternoon, everyone. Thank you very much for that introduction, Kirsten. Happy to be providing this update on the needs assessment. This needs assessment is a quantitative and qualitative evaluation of transit demand and transit needs within the region, or within each of the regions, rather, for rural and human services transportation across Georgia. And this needs assessment that we're conducting aligns with a previous needs assessment that GDOT conducted for its statewide transit plan back in 2019 and 2020. We're effectively doing an update of those numbers to capture ongoing demographic trends and economic changes in these numbers in order to have a better understanding of what the current and projected transit demand levels are. The methodology that we're using is, in addition to being consistent with the GDOT methodology, this methodology itself is actually taken from a national report produced by the Transit Cooperative Research Program on measuring demand for rural transit really across the nation. So it's seen as a pretty robust and reliable methodology. Next slide, please. So this slide captures the results of the two types of analysis that we conducted as part of this methodology, the non-program demand assessment and the mobility gap demand assessment. And both of these assessments are conducted for the current year of 2019 and the future year of 2050. Both methodologies draw on a lot of demographic information about each region and each county in order to produce its assessments. And so when I say 2019 is the most recent year, that's because that is the most recent year of data available from the data source, which is the American Community Survey produced by the U.S. Census. It's produced on an annual basis, but it's the data is usually cleaned up and analyzed and made ready for kind of public consumption. And so it's released on a bit of a lag. And as a result, 2019 is the most recent data that we have to work with. So the two types of methodologies, like I said, look at certain demographics about who is likely to use rural and human services transportation. So it focuses on certain demographics that are generally seen as transit reliant or transit dependent. For the non-program demand assessment, this consists of people who are 60 and older, people with disabilities, and people who live in zero vehicle households, by which we mean a household in which the residents do not have ready and consistent access to a private vehicle. The non-program demand assessment is seen as the lower bound estimate. It produces essentially the minimum projected level of demand for the region. The mobility gap demand assessment takes a slightly different approach, where instead of looking just at demographics, it considers the travel behavior associated with those demographics. So the mobility gap is actually a calculation in the number of trips taken between a one vehicle household and a zero vehicle household. So essentially seeing what sort of opportunities for travel do people in zero vehicle households lose out on compared to their neighbors or their other folks in the region who do have access to that vehicle. And again, that's seen as the higher bound estimate. This allows us to capture a range of transit demand, both in 2019 and 2050. So what we see when we look at this is an estimate of rural demand compared against the number of rural trips provided, and then the costs necessary to fill that gap. So in 2019, transit agencies throughout the Georgia Mountain region provided about 66,000 total trips. But the estimated demand under the non-program demand estimate was about 246,000 trips. And under the mobility gap estimate, that was nearly 567,000. So again, you see that span of demand. What this means is there was unmet rural trip demand of about 180,000 to 500,000 total trips throughout the region in 2019. Now, we estimate demand in 2050 as well by using population growth rates at the county level. These population growth rates are compiled and developed by the Georgia Governor's Office of Planning and Budget. They produce population projections on a county basis to capture every year between 2020 and 2065. And what we see is that this demand increases in the future due to population growth, due to population growth and demographic changes within the region. And that demand increases to 287,000 trips under the non-program demand evaluation and 770,000 trips under the mobility gap demand evaluation. That final row shows the total costs, both capital and operating, that is needed to meet 100% of that demand rural trip demand. So again, the 240 to 280,000 trips estimated by the non-program demand, and the 560,000 to 770,000 trips estimated in the mobility gap demand. And so obviously this implies a large range. Within 2019, meeting 100% of that demand would require an additional 5.8 million to 15.4 million in capital and operating resources. And meeting that demand in 2050 would require 7.7 to 22 million. So again, this is just indicating what is needed to meet 100% of total demand for all transit agencies within the Georgia Mountains region. So it's designed to be a kind of maximal approach to show what would be necessary to achieve that, to fill in that gap. It's not a recommendation for service per se. Next slide, please. There's an additional type of analysis that we conduct for estimating transit demand that looks a little different from the previous two. The non-program demand assessment and mobility gap demand assessment both focus on kind of the transit service needs that are needed for all types of mobility. So workforce, education, healthcare, grocery trips, everything. This is a little different, where this is measuring commuter transit demand assessment. So specifically the types of demand that are generated when people want to cross county lines in order to go from where they live to where they work. This is essentially representing the demand pattern of a commuter, someone going to work in an office or a factory or a facility, a hospital, wherever, however many days per week they work. And so it captures the kind of economic relationships that exist within the Georgia Mountains region, reflecting the fact that there are probably going to be large concentrations of people in more residential areas traveling to the economic hubs within the region or even outside of the region. Now, we do recognize that there are going to be a lot of those trips taking place really throughout the region. You know, it's very common for people to live in a different county from where they work, but we specifically focus on demand estimates for trips that would generate over 100,000 transit trips, commuter transit trips per year. That's because you need a volume of demand that's high enough to kind of justify the capital and operating costs of a commuter transit service. So 100,000 trips is used as a kind of rough cutoff for that. And what we see, and I'm sorry, the daily commutes and the daily commuter transit demand data also comes from a slightly different source than usual. It's a combination of information from the Georgia DOT travel demand model, which is used to estimate and model travel behavior throughout the state, and then another census database that estimates intercounty travel flows. So we use those two pieces of travel information in conjunction to make this estimate. And the daily commuter transit demand is actually based on a proxy estimate of home-based work trips. This is because we're trying to estimate a demand that isn't currently fulfilled by existing transit. And so home-based work trips are essentially taken as a proxy for that, a level of activity for daily commutes that aren't being fulfilled by another travel mode. So based on that estimate, we produce an annual commuter transit demand of about 650,000 trips in 2019, which grows to 850,000 trips in 2050, specifically for the travel corridor between Hall and Gwinnett counties. So this shows, again, a potential demand for that kind of express bus service commuter transit type model. And all of this will be factored into our analysis and our alternatives and analysis for deciding and informing recommendations. Next slide, please. In addition to our quantitative analysis, we've also been relying on a qualitative analysis through two surveys that we've issued to different stakeholder groups. A provider survey, which has been sent directly to transit providers, and a rider survey, which is open to the public. Both of these try to get direct input from our stakeholders on what their needs and priorities are for rural and human services transit. These surveys are still open, as you can see on the slide. There's a QR code that you can scan right now to take the survey if you haven't done so yet. If you have, thank you very much for your participation. Similarly, the rider survey is open as well through the end of the month, and we encourage you to distribute that survey to friends, family, colleagues, etc. But now we just want to go through some of the findings that we've seen so far. So on the provider survey, we've received 36 responses to date. We're pleased with that level of engagement. What we've noticed is that slightly fewer than 50% of respondents indicate that they are able to carry riders to destinations outside of their jurisdictional boundaries. So it suggests that there's that potential gap in terms of helping people get to areas that might not be located directly in the same county that they live in. And similarly, by a ratio of about 2 to 1, respondents haven't pursued coordinated human services transportation or regional transit service. So again, it speaks to perhaps an administrative gap or a capacity challenge in terms of building the infrastructure to maintain that kind of coordinated service. We noticed several agencies have reported less ridership in 2020 than 2019. 6 respondents indicated that they had fewer than 5,000 trips in 2019, but this number increased to 10 for 2020. We're not surprised to see that. You know, obviously, COVID-19 had a huge impact on transit demand. It had a huge impact on people's lives, on their travel needs. But it does indicate that our transit agencies are in a more difficult position than they had been even in the base year for our analysis. So we're trying to factor that into our recommendations as well. We asked for transit providers to provide input on what sort of technology that they're using. And we got some very interesting responses. We asked them to indicate both the ones that they are currently using and the ones that they are considering using. And most notably, 2 respondents indicated that they're currently using a smartphone app or website for trip planning and fare payment, while an additional 8 agencies are considering adopting this tool. So we're seeing the transit service providers in this region take a more kind of tech-centric focus in some of their planning, which is great to see. We also asked about state of good repair needs in order to figure out what sort of resources may be most critical. And we got a very interesting set of responses where the first one, pretty standard response is purchasing new vehicles. Of course, that's a classic issue for state of good repair. But the second highest response was a challenge around establishing regular maintenance schedules. What we heard from several of our providers is that they share maintenance resources either with other transit providers or other county facilities within their region, and therefore don't have immediate access to those maintenance services when they need them. And so maintaining their vehicles in a sufficient state of good repair such that they're able to then deploy them for service can be a real challenge. From there, we asked some additional questions around the significant challenges that transit providers are experiencing. And again, we heard the same sort of workforce challenges here as well, that maintenance workers and drivers are in very high demand, so attracting and retaining qualified personnel can be a real challenge. Again, we see that as kind of part and parcel of the impacts of COVID, that the contributions that it's made to the Great Resignation, to job loss, job displacement, and the various challenges really felt throughout the workforce. It's hitting the transit agencies as well. But the other main administrative challenge was the compliance with state and federal reporting, which again, a very kind of classic challenge for these transit agencies. We know a lot of the transit agencies are small, they've got limited staff, but they have pretty extensive state and federal reporting requirements to meet. So we're sensitive to that challenge. With rider demand and satisfaction challenges, we heard feedback about the difficulty of expanding service into new markets. Again, a very classic problem for rural transit is making sure that they're responsive to where people need to go, want to go. But then we also just heard feedback about dealing with the public perception of transit. Again, something very much impacted by COVID, when all of a sudden people no longer felt safe about spending time in enclosed spaces with other people. So we're trying to be cognizant of those challenges as we shape a path forward. We also asked for open-ended questions and allowing people to, or I'm sorry, open-ended comments, allowing people to provide whatever additional comments they wish to. And again, that's where we saw emphasis around the challenges with federal and state reporting requirements and the attraction and retention for drivers and mechanics. Next slide, please. Pivoting to our rider survey, again, we've seen a good response rate on this, but a very interesting response rate, where we've got 55 responses to date, but 85 of those respondents indicated that they do not currently ride transit. Obviously, we're glad to have those responses, because if these are people who aren't using transit but see a need for it, or even just a want for it, and they can help us understand what their priorities are and how current transit services aren't meeting their needs, that's extremely valuable for us. But of course, we also want to get additional responses from people who are riding transit, so that we can understand the actual current challenges of that transit service provision from the rider's perspective. Among those who do ride, they indicated that their main reason for riding is that they lack access to a vehicle, and they use transit to get to work, to get to medical appointments, and dialysis appointments. So again, this transit service is really filling a broad array of needs for customers. They do indicate that if transit were not available and they had to find an alternative, they would most likely get rides from friends or family members. So it speaks to the availability of alternative services. People aren't necessarily stranded, but it's still, it can be complex, it can be problematic, it can be inconsistent. So there are definitely ways to, or rather, there's definitely a need to expand mobility in a way that provides greater consistency and reliability for these folks. Among those who don't ride transit, they indicated that their most common reasons for not doing so are that they are interested, but transit is not convenient. Again, a very standard response. But unfortunately, also that another very common response was that they are not interested in riding transit, which speaks to that public perception, perhaps even beyond COVID, that people just don't see a role for transit in their daily lives, which again speaks to some of the challenges that we recognize these transit agencies are facing. Among those who do ride transit, they indicated that their challenges for using transit and using transit for a wider array of trips is that it's not reliable enough for time-sensitive trips, or that it doesn't go to where they want to go. So again, speaking to perhaps that kind of coverage issue and that need to travel across county boundaries, or that the distance to the nearest transit stop or transit facility is too far. So there's that need for more kind of first mile, last mile connectivity in this service. We also asked, regardless of whether or not people use transit, we asked them what they want to see improved and prioritized within transit service improvements. And the responses here were very interesting. There was the real emphasis about prioritizing improvements that expand access to jobs and to healthcare and connect different parts of the community and region. So again, we get that kind of clear, direct need for meeting a variety of trip purposes and covering a more expansive area. We also asked riders for input on the transit technologies that they wanted transit agencies to prioritize. And here again, we see a need for more information about the consistency and the reliability of the transit service, because what we heard was more demand for real-time arrival information, both at the transit stops themselves and real-time information available via smartphone, website, or text. So again, people are looking for more information to understand how they can access transit when their transit is coming and how reliable it will be for their time-sensitive needs. And that concludes the current needs assessment, so I will hand the presentation back over to Kirsten.
Thanks, Baird. For anybody who has joined us during this meeting, just want to remind everybody that if you've joined by computer or by smartphone through the Teams, we ask that you use your raise hand button or enter questions in the chat box. If you are calling in from a phone number, you cannot raise your hand or use the chat box, but we welcome you to unmute your phone and provide some input. So now we're going to get into the discussion piece of the workshop, and we've got some questions for participants, but also we'll be happy to answer or take feedback from anybody on the workshop as well. So generally speaking, I think, it's this is the time where we want to get all of the needs from the region, any sort of constraints, any sort of gaps in service, any sort of connections that are missing within a certain transit provider or within the region, any sort of need. It can be administrative, it can be operational, it can be just general, we need more money. Those are the things that we want to hear and, include into our needs assessment so that we can identify some projects, programs, and policies that may help solve some of those challenges that you're having. So these are just a couple questions. I think we do have a caller on the phone. If you have any thoughts, or any comments about rural or human services transportation, we'd love to hear those now. Another set of questions that we're very interested in learning more about are coordinated services. So if you are a transit provider and you're not providing coordinated services with other transit providers, maybe what's the reason for that? What are some of the barriers to get a coordinated service up and running? Maybe there's no interest in a coordinated service and you feel like everything is operating fine, but those are the types of things that we want to hear. There's some coordinated models across the state. And then there's still lots of areas that do not have official coordinated services. So anything you want to add, Matt? Maybe there are services that you want to provide but can't because of funding constraints, or you don't have enough drivers, or you don't have enough vehicles, or because you're in a rural area, those trips take too long. And you just can't provide certain trips. The last set of questions that we have, and again, I want to encourage anybody who watches the video of this presentation to please submit questions and comments after this meeting. We'll have more information on how to do that in an upcoming slide, but things that we're also looking for. What other needs do you have outside of your service area? Are you finding that you need to provide trips outside of your jurisdiction, but cannot? Are you finding that the cost to the rider is preventing higher ridership? People don't want to ride because it's getting too expensive, especially as you're starting to see these riderships decline due to COVID. Are you having to increase fares to, make up that fare box recovery? Are there operating or administrative needs that you're struggling with? Maybe it's your front of the office. Maybe it's your scheduling platform. Maybe it's you don't have enough drivers, or you have a hard time training and retaining drivers. We heard in another region that one of their issues are mechanics, and being able to find mechanics in a timely manner because they have to share those mechanics with other county services or with other transit operators. And so their vehicles are out of commission for a longer period of time. Maybe you have training needs. And, I keep mentioning over and over, maybe you just have simple funding needs. And if you did have the funding you needed, how would you spend it? Where would you spend it? So, Matt, I'm going to turn it back over to you to finish out the presentation so we can get to the contact information where people can submit questions and comments.
Awesome. Thank you so much, Kirsten, and thank you so much, Baird and Will, for the information. To review our schedule one more time, we're working on the existing conditions assessment and the alternatives analysis now, and we'll start the development of the final draft report in the coming months. We are targeting July for publishing the draft final report, and it'll be available on the GDOT Transit website for public comment. Once again, I want to thank you so much for your participation today in today's workshop. And if you see this video, please don't hesitate to reach out to me or Kirsten with any questions or comments on the information we shared today. Also, we ask that you complete the RSST survey. If you're a provider, there's a separate provider survey. And if you're a rider, there's a separate rider survey. If you're on the phone, you can find the surveys at www.dot.ga.gov/transit. And my email is mawilson@dot.ga.gov. And we do ask that you send any questions to us before March 4th, so we have time to respond. Finally, just a heads up, the GDOT Transit Program is also working on a regional transit development plan in the Georgia Mountain region, and as well as a statewide intercity bus study. And you'll find more information about those efforts on our main transit website as well. With that, if there are no other questions, I just want to say thank you again so much for the time this afternoon and hope everybody has a great day.